Rates of childhood asthma have tripled in many countries. The incidence of childhood cancer is going up steadily by 1 or 2% per year. The prevalence of neurological disorders like autism, attention deficit disorder, mental impairments is rising from year to year, and it's estimated that approximately 1 baby in 6 is born with a neurobehavioral impairment. These are very disturbing trends. My name is Dr. Philip Landrigan. I'm a pediatrician. I worked for many years at the CDC, the Centers for Disease Control and Prevention in the United States. I'm now a professor at Boston College in Boston, Massachusetts, where I direct the program for global public health and the common good. Children in today's world are surrounded by an absolute multitude of new chemicals and new plastics that did not exist 50 or 75 years ago. Globally, rates of plastic production have increased 250 times since 1950s. Plastic production is on track to double by 2040 and triple by 2060. And these chemicals and plastics pollute the entirety of the Earth's environment. They're found in air, they're found in water, they're found in soil, and they're in us. They're in adults like myself, and they're in all of our children. When national health agencies like the CDC in the United States and their counterparts in Canada and Korea and the European Union do surveys taking blood samples and urine samples from people, those agencies routinely find between 200 and 300 manufactured chemicals in the bodies of virtually every person whom they test, men and women, old and young, pregnant women, newborn babies. Every one of them have between 200 and 300 chemicals in them. And increasingly, those surveys are also detecting invisible microplastic particles in the bodies of people all around the world. Firstly, young children, kilogram for kilogram of body weight, are much more heavily exposed to toxic chemicals than adults. This is so because children breathe about 4 times as much air per kilogram of body weight per day as an adult. They eat more food, and they drink as much as 7 times more water per kilogram. So that means that any toxic chemical that's in air, that's in food, that's in water, children consume that chemical in proportionally greater quantities. Also, children have unique behaviors that adults don't have. They crawl on the floor, they put their hands in their mouths. All of that magnifies their exposure. We've known for decades, for example, that a major route of children's exposure to lead is that they get lead dust on their fingers from the environment, and then through their hand-to-mouth behavior, which is quite normal for a 2-year-old, they put their fingers in their mouths and they get lead poisoning. So increased exposure is the first reason that children are more vulnerable. Secondly, children, and that includes infants in the womb during the 9 months of pregnancy, are going through extraordinarily rapid, complex, tightly choreographed processes of development. Every organ in a child's body, the heart, the lungs, the brain, have to go through these incredibly complicated series of developmental stages so that they're all in place and ready to function by the time the child is born. Those stages of development have to take place on time and in the proper sequence. When a system is that complicated, it's easily disrupted. If the wrong chemical gets into a baby at the wrong time during pregnancy or during the first few years after birth, it can have devastating effects. We first learned this in the 1950s and 1960s. At that time, a terrible disaster struck children, especially in Europe and Asia. referred to as the thalidomide disaster. Thalidomide was a synthetic chemical marketed as a sedative, and it turned out to be very, very effective at suppressing nausea and vomiting, so-called morning sickness, in women during the first trimester of pregnancy. And so it was very heavily prescribed to women during pregnancy. 9 months later, babies started being born missing arms and missing legs, and some other abnormalities as well involving their eyes and their ears. And it took the medical profession a few years to connect the dots, but soon enough they realized that the cause of these terrible birth defects in infants was thalidomide. And so thalidomide was pulled off the market, and the epidemic very rapidly came to an end. But it was a painful, painful demonstration of the unique vulnerability of infants and children to the chemicals. The mothers who took the medication were unscathed, but the synthetic chemical in the drug caused devastating birth defects in their children. Thirdly, infants and children have immature metabolic systems, and so they have trouble getting rid of toxic chemicals. Once those chemicals get into the body, the chemicals stay in the bloodstream much longer. And then finally, infants and children have many years of life ahead of them. And we now know that a lot of the chronic non-communicable diseases that afflict children today take decades to develop. So it's this combination of factors: greater exposure, metabolic vulnerability, developmental vulnerability, and long anticipated lifespan that collectively make children very vulnerable to the toxic chemicals that surround them in today's world. What we have now discovered through epidemiologic and clinical and toxicologic studies is that a number of the chemicals to which children are exposed do in fact result in disease in children. Lead, manganese, phthalates, organophosphate pesticides are among the chemicals that are known to damage the developing brain of infants and children, to result in reduced IQ, behavioral problems that last lifelong. Other chemicals damage the heart, the lungs, the liver. Bisphenol A, a chemical widely used in plastics, increases risk of obesity, diabetes, heart disease, and stroke. Phthalates are another class of chemicals widely used in plastic. Prenatal exposure to phthalates reduces children's IQ and causes behavioral anomalies. So, to summarize, children today are exposed to thousands of chemicals. Rates of chronic disease in children are increasing. Children are exquisitely vulnerable to the thousands of chemicals to which they're exposed. And therefore, we now know with an absolute certainty that toxic chemicals in the environment are responsible for a wide range of disease in children. There is good news here. And the good news is that disease caused by toxic chemicals can be prevented. And the secret to prevention is, first of all, to identify the toxicity of the chemical, to establish the link between the chemical and the disease in children, and then to take intelligent measures to reduce children's exposure to the chemical, which may include banning the chemical, restricting its use, keeping it out of certain products, otherwise regulating it. And there are some enormous success stories here. In the United States, where I live, air pollution levels have come down by 77% since we passed the Clean Air Act in 1970. And the result has been the prevention of literally millions of cases of asthma, heart disease, lung disease, stroke, as a result of cleaning up air pollution. Another example is lead. Lead used to be added in enormous quantities to gasoline, to petrol, in countries around the world to help automobile engines run better. Starting in 1975 in the United States and followed soon thereafter by many other countries, countries started taking lead out of the gasoline because they realized that that lead was contaminating the environment, getting into children, and causing brain damage. And what we've seen in country after country as a consequence of the removal of lead from petrol is that blood lead levels in children have come down. In the United States, for example, children's blood levels have come down by 95%. The average IQ of every child born since lead was removed from gasoline is about 5 points higher than the intelligence of children who were born when they were heavily exposed to lead. So, chemicals in the environment cause disease in children, but disease caused in children by chemicals can be prevented.